Access to behavioral health and mental health services remains a serious challenge in rural communities. How will your leadership ensure that students in small and remote districts receive that equitable access to mental health and social emotional supports?
Yeah, so as a father of a teenage daughter, this issue of youth mental health is, my personal experience in my family has always informed my advocacy for youth mental health funding, especially. So coming out of the pandemic, we know that we saw a dramatic increase in mental health challenges. The legislature. Working with the governor, we passed the Children and Youth Behavioral Health Initiative that provided billions of dollars, to provide for more mental health providers. The bureaucracy again has been too slow in terms of developing the fee schedule for school districts to be able to access those funds. And so that's something. I was at a conference recently where we were talking about that. Extremely frustrating. I've been working on that issue to try to get the Department of Social Services to get that fee schedule streamlined so that we can get the funding out to school districts. But I think again, rural districts have a unique challenge in that similar to the reason why rural hospitals are closing, and why when I was up in Shasta again, I heard about how when people deliver babies, they have to helicopter them to the nearest hospital. I mean, rural communities, we have a dire shortage of healthcare providers, which again, I think we need to. Similar to what the other candidates have talked about, we need to grow the local talent. And one idea I have is training more educators through our community colleges so that we can get local people serving in local schools, including becoming mental health care providers.
Let me start by agreeing with Al, especially as it relates to the grow your own approach to more mental health support and professionals in the area. We need a kind of a baseline for mental health supports across all schools that is appropriate to the need in a particular school. We need to fund this above and beyond the Prop 98 allocations, as Anthony pointed out. We need to integrate mental health fully into California's school systems. We need to support trauma-informed care, every approach to social and emotional learning that will support mental health, and then center those schools as integral parts of the community, not just for the delivery of mental health to students, but as a nexus for families as well. And so to do that well, we have to break down a number of silos. And so the Mental Health Services Act provides substantial funds every year for mental health services, not as well integrated with the educational systems as it should be. And in doing that work, we need to partner and force counties to be better partners to school districts and to schools to provide some of the resources that come to them through the MHSA.
Limited access to counselors and behavioral health specialists is a health concern in all of our schools, rural and large. Mental health is a foundation to learning, and social and emotional supports can literally mean the life or death of our children, as we're seeing a marked increase in the number of suicides in children under 12. Every school should have full-time counselors and or mental health professionals, regardless of their zip code, because we cannot determine the time that a child will need support. And children have difficulty articulating the needs that they have. So we talk about trauma-informed care, but we have to, as adults, be able to anticipate what children are going through. In rural areas, we have poverty. In rural areas, we're dealing with insufficient potable drinking water. We're dealing with homelessness. We're dealing with food insecurity. All of these issues are impacts to students' mental health, and being able to provide these services and access to services, for children to talk to and families to get support is vital. As SPI, I will create and expand rural telehealth partnerships where we have mental health counselors outside of our mental health counselors at our school sites that are visiting our school sites and being available to community members as well as our students and school site professionals. And this will allow us to embed our mental health training and teacher preparation programs and expand grants for trauma-informed practices. As a teacher educator in the program that I work with, that is what we do. We do talk to make sure that our candidates understand how to be socially and emotionally aware in terms of being of educators in our curriculum, but also working with them to have them understand how they impart and impact themselves in the school districts and the schools that they are serving in, and also to create community-based partnerships.
Issues in and around mental health are things that we honestly didn't really talk about as a society much in the past. So it's good that we're having the conversation, particularly in and around schools. Earlier, I talked about running early childhood education programs. I ran 2 sets of programs. One were Head Start programs, and the other ones were non-Head Start programs. The big difference between Head Start and non-Head Start was the healthcare services and the wraparound services. If a child was enrolled in our Head Start programs, they received mental health services. If a child was enrolled in one of our other services, one of our other programs, a state or a county funded program, they didn't receive mental health programs. You see as a provider right away the difference that has, the impact that has on a child and on a program immediately. Now imagine that, magnify that across the lifetime of a child, and magnify that across the lifetime of a community. We know those programs are incredibly important for early childhood education. But when COVID broke out, I was on the UC Board of Regents and the Cal State Board of Trustees. At the Cal State Board of Trustees, I know our mental health services increased during COVID by at least 20%. At the UCs, I'm not going to make up data. I don't remember. I remember they did increase significantly at the UCs as well. I'll have to look it up. I don't remember what it was. We saw that in community colleges as well. And what's interesting is I was just meeting with the union representative in my daughter's school district. The increase that they had in that school district in mental health services during COVID never ended up decreasing. So I think we're doing a lot more with screening, and I think we're doing a lot more with early detection, and we need to make sure that we stay on that, and make sure that those mental health services stay with our kids throughout their time in school.